thinking, we've never done a chewing the fat as me being a coach. It's always been you coaching me. So I kind of wanted to look at it from a consumer point of view of getting your insight. Excuse me, I'm still recovering from a flu. Your insight in Simplr Health, the intricate details behind it, and what makes it so amazing. I obviously know because I've done it, but sometimes it helps to hear it from the source.
Sure. What is it you want to know?
Okay, firstly, how did Simplr start?
Oh, wow. Okay. So Simplr, this is many iterations over a long period of time. Essentially, it started with me meeting a gentleman called Bob Grantham at a medical conference, and he was just this awkward looking dude standing next to an exhibit, and I felt sorry for him because no one was talking to him, and which kind of paints the picture of medical world's relationship to these types of offerings. And anyway, we hit it off, and he's an old school biochemist, and so we started talking about the Krebs cycle and boring stuff like that for most people. Anyway, it turns out he was one of the corporate owners of this billion-dollar company, and we just hit it off. And anyway, I was interested in that kind of approach and what it could offer people. At the same time, I was working up regenerative medicine offerings here in Australia. That kind of eventuated to the point where I opened up my own clinic in collaboration with a couple of other senior medical professionals here in Sydney. And we were treating osteoarthritis with a stem cell approach where we would take a little bit of fat tissue from your belly, periumbilical region. So this mini lipo aspiration, we would call it, and we'd get about 40 grams of fat. And in the laboratory, be able to isolate those stem cells, the mesenchymal stem cells, and grow them to high numbers and store them for later use. And when it was time to inject the stem cells into a person's, say, knee, which was, had osteoarthritis and limited range of motion, and it was painful and it was disrupting their ability to function in life. And they were looking down the barrel of total joint replacement surgery. And maybe some of these patients weren't old enough yet, or it wasn't quite appropriate for them to undergo surgery. So they didn't really have any other options. And so that's what we were providing as another option.
Wow.
But I don't know, it was like 85, 90% of the patients that we were treating had metabolic syndrome. They were overweight. So when you look at regenerating tissue, one of the key background contexts that need to be handled is inflammation. So inflammation inhibits proper tissue regeneration. So you got to put the fire out first. It's like if you've got bushfires, here in Australia, you can't talk about regenerating the forest until you put the bloody fire out first.
Yeah.
So for a human being in our own physiology, the fire is the inflammation. And this is what kind of exacerbates and causes much of the degradation and tissue degeneration. And the key driver of inflammation in a state where someone's metabolically deranged, essentially, they're insulin resistant, they're overweight, etc., and they've got some other ailments like high blood pressure and high blood glucose. Clearly, their belly is larger than it ought to be. Things like that, right? This is collectively, we call it metabolic syndrome. And the biochemical environment of weight gain, of inability to lose weight, is hyperinsulinemia. So too much insulin being released by the pancreas. Why? Well, insulin is released when we eat too much carbohydrates. And if we're eating dessert essentially throughout the day, i.e. toast and cereal for breakfast and tea cake at 10:30, and then a sandwich with a juice at lunch, and then by mid-afternoon you're like blood sugar levels peaked and then dropped and it's gone too low, and now you're like craving a Tim Tam and a cup of tea, and then you have dinner, and your dinner might look great, and you kid yourself and think, yeah, I ate really well. and then you have ice cream after that before bed. So it's like dessert, dessert, dessert. So people's insulin levels are chronically elevated, and that's the primary driver of much of the inflammation that we see in these patients. So I was looking for someone to help manage the nutritional structure of these patients that were coming in to get their stem cells injected into their knees before the procedure and then after. And I couldn't find the right kind of program here in Australia that was set up. And in my investigations, then it occurred to me, which I'd never really looked at in much detail before, why the issue of being overweight and obese is so rampant here in Australia. There is no real quality structures that can assist health consumers in being able to handle their well-being and teach them how to manage that for the long haul. So I reached back out to my buddy who was from the US, and they have this structure in North America that I learned as much as I could from them and that company and the founder. And then I added my twists onto it and learned from my scientific community. And at Simplr Health, our senior scientific advisor, Dr. Antonio Civitarese, is a world-leading nutritional biochemist, and his whole area of expertise in life is mitochondrial dysfunction, skeletal muscle metabolism, and obesity medicine. And he was one of the key, scientists involved in the development of these injectable anti-obesity drugs. They're anti-diabetic originally, but now they're being used just for people to lose weight. Semaglutide. He was the scientific director of obesity for Novo Nordisk, who brought semaglutide to the market. Now, post that, I've since worked with him to set up a metabolic clinic in San Diego that doesn't use medication and drugs. And he knows all the inside details about the science of modulating the incretin system, which those drugs do, and thinks it's, in the vast majority of patients who are struggling to handle their metabolic health, a nutritional coaching approach is the best option. Yeah, and that's coming from one of the people right in the know. So, when you're helping people lose weight, handle their inflammation, and as a byproduct of that, they lost a heap of weight. When they're walking around 40, 50 kilograms lighter, obviously everyone in their life is like, what the heck did you do? And they just kept saying, oh, talk to Dean. So I wanted to be a stem cell guy. And then all of a sudden I was the guy you come to when you're too fat, which is, I didn't want to be that guy. It's like dealing with fat people. I don't want to do that. They're a pain in the backside. They've got this fatitude about them. They're like, demanding and entitled and impulsive and very juvenile in their behavior. I don't want to spend my days working with these people, but, I thought, let me help a number of people through the pandemic. So the pandemic came about, and there were two issues that I wanted to see what I could contribute to. One was giving people an opportunity to have the science explained, and then working with them to handle their metabolic health. So if they're in poor metabolic health, they were more susceptible to severe symptomology if and when infected with COVID. So I wanted to make sure people were sufficiently prepared immunometabolically to be able to handle the pending infections that were about to, come through us all. And the other one was, what could I do to contribute to ending the pandemic? And my original scientific background before metabolic disease, before cell physiology, was in fact molecular virology. So I have a background in, emerging infectious diseases and metabolic dysfunction. So it kind of all of a sudden, for a few people, I became relevant and just started helping them. And, Simplr is an acronym. It stands for the science of immunometabolic protection or preparedness, longevity, and regeneration, SIMPLR. And, this is a long-winded way of saying I was basically looking for whatever was wanted and needed and seeing with my skill set and knowledge base and network, what could I provide? What could I contribute? And that's how Simplr Health came about. Yeah.
Wow. I always, I must admit, I always forget that acronym and have to refer back to remember what it is.
It's for the geeks. Really, it's just, we make science simple and managing one's health simpler. And there's just so much. This is what we've got to deal with, is just the massive information and misinformation on so many different levels. And how do you explain the complexity of the science to someone in a way that doesn't dumb it down? When you dumb things down too much, what you're effectively communicating to the audience, to the listener, is that they're dumb. And that it needs to be dumbed down such that their pea brains can understand it. No. That's such a small listening of people. So what I like to do is relate to people as big enough to be able to handle this information, and they've got to learn the language. And where people have a lack of power in their life, and if they lack power in their health and well-being, then what's missing is distinctions in health and well-being, and mostly scientific distinctions. And to wrap your head around that, you got to understand, you got to learn the specialized terms and how they're networked together in a way that offers meaning, right? And when you do that work, that you put in that intellectual effort, and someone's there standing shoulder to shoulder with you, guiding you through the process, and at the same time coaching you to have an as-lived experience of what it is that you're learning, it gets ingrained. And you can never unlearn that stuff. When you learn that what actually drives weight loss is not more time at the gym, it is a sufficient calorie deficit. What transforms your biochemistry and balances your hormones is modulating the macronutrients of your diet and being able to stick to that consistently for a long enough period of time such that your body can adapt. So it's enough adaptive flexibility in the human body to be able to manage this. There's multiple distinctions, and then we get into the world of, human behavior and performance. And so I brought together with all the science and science education, my background training in performance coaching and transformational coaching. And 15 years, I was a leading trainer across the ANZ region, and coached, trained, and developed a number of people, thousands and thousands of people. So I bring a lot of that experience to this. And now, because it's a very personal journey dealing with one's health and well-being, created a structure where people can get one-on-one coaching, be educated, be fully appreciated and understood for where you're at. We have a very, very deep, as you would appreciate with the people that you're coaching, deep understanding of what another is dealing with. And you've dealt with it and you've gone through it. And at the same time, we don't relate to them as anything other than extraordinary and capable of handling the challenge. It's not like that we're sympathetic. No, we're compassionate, like ruthlessly compassionate. It's like, come on, I get it's hard. I've been there. I'll cry with you. But at the end of the day, we're here to get the job done and produce the result. And that's what we're all about, is contributing those kinds of clinical outcomes to people's lives such that they can get on with what really matters to them, whether it be an athletic career, becoming a coach themselves, succeeding at business, being the best person they can in their family and with their kids, living as long as they possibly can, to keep creating trouble on this planet, or contributing something, big to the greater good of society, whatever it is that really matters and is of interest to people and that they're committed to. If their health and well-being, energy levels, lack of clarity with their thinking, ability to make decisions, joint pain, whatever it might be, if that's in the way of them fulfilling on what they're really here for, then, we want to be their partner to get that barrier out of the way such that they can really fly.
I really like ruthless compassion. That's, I like that wording. That's great. Because it's exactly right. I think the way the program is sort of structured, you are genuinely holding someone's hand. You know, a lot of the time it takes a lot of courage to stand up and be like, okay, there's something I need to be doing better. And that takes you having a real hard look at yourself and going, okay, there's something that I'm not able to fix on my own and I need support for that. And that's not always easy.
Yeah, yeah. And it's more so there's something that I just can't see for myself.
Yes.
And that's why I have a coach, because a coach can see what's hidden from your view. They can see what's in your blind spots. So you really want to work effectively with the coach. And, if you're paying for it, certainly get your money's worth, like be a demand on the coach. But if you're going to be a demand on the coach, then you also have to expect that they're going to be one hell of a demand on you, because it's not their fat ass that's being dealt with, it's yours. Right. So,
We've
and
already dealt with ours.
that's right. But the ruthless compassion, there's multiple ways of saying that. Another way of saying it is tough love.
Yeah.
And that's really, at the end of the day, fundamentally, that's what really is consistent with every single client that we work with. That's actually what works and produces the result. And we just have to figure out what version and expression of tough love will work with every single person. And not one way works with every single person. So it's a bit of a dance. But you commit at the beginning, I don't quit, you don't quit. Let's just keep going together in the fire together, shoulder to shoulder, and we'll work it out. And we always get there, like every single time. Yeah.
Yeah, definitely. It is that commitment and that ability to see that we're in it for them. We're walking every single step of the way for them. I think that's interesting how you say that everyone's a little bit different, and handling everyone, that tough love is a little bit different. Why then, and I know the answer to this, but you can articulate it, why is the protocol the same for every person?
Uh-huh. Yeah, because fundamentally your physiology is all pretty much the same. This concept of personalized medicine, yes, there are genetic variations. There's certainly very distinct gut microbiomes between individuals. However, if someone's 100 kilograms, 150 kilograms, 80 kilograms, whatever it is, they're at that weight and that performance, their body is that performance outcome, not because of the genetic variations. They've just been eating too much cake, right? So you got to stop that, cut it out, right? And they can't, because they don't know why. They're driven to eat certain foods, and it's predominantly a sugar fat combination, carbohydrates and fat. Well, firstly, that combination tastes freaking amazing, right? Secondly, it's highly addictive, right? That nutrient combination is appropriate for an infant consuming it in the form of breast milk. Whilst they're in the most rapid growth period of their life, it's just not appropriate post-weaning. We're the only mammal that continues to consume dairy post-weaning, and then bastardizations of that nutrient combination in the form of cheese on bread, ice cream, pizza and burgers and everything, deep fried potato. It's just fat and carb. So donuts, etc. So they do have an addictive quality. So that macro view is absolutely, that's what needs to get handled. And if it really was all about, but that I got to work out what's best for me, quite frankly, that's a cop-out. And I'm not even pointing the finger at the health consumer. It's a cop-out on the practitioners that we entrusted to get the job done over many decades. And they've become so resigned, quite frankly. And, whether or not they knew, who cares? That time has passed. But at the end of the day, when a practitioner says, listen, at the end of the day, you got to work out what works best for you. Fundamentally, what they're doing is deferring accountability to the health consumer that lacked power in being able to deal with it in the first place. So then the health consumer is not accountable. They're trying to defer it to a practitioner. The practitioner is either deferring it back to them, saying it's a lack of willpower, and at the same time, you got to work out what works best for you. I mean, it doesn't really give people much of an access to get the job done. Or say, for example, in the case of a GP, when the burden on the patient's body becomes so great, then they'll defer them to a specialist. If it's metabolic dysfunction and the hormones are out of whack and they're pre-diabetic or even newly diagnosed diabetic, they'll get referred to an endocrinologist. Now, I've spoken to endocrinologists. I've worked with them. I've spent many years in the lab with endocrinologists. I've also spoken to endocrinologists who tell me, Dean, by the time a patient comes to me, they want pharmacology.
Yeah.
And I'm like, no, you want pharmacology for them. They don't want to be on drugs and injectables, and that's not what they want. They just want to be well.
Yeah.
I've spoken to preventative cardiologists who I've shown the data that we can generate. And one of Australia's leading preventative cardiologists said, Dean, this is outstanding. I've never seen data like this before. This is incredible. Like 3 years post weight loss, average weight loss in this clinical study was 15% loss of total starting body mass in 12 weeks. Now, if you compare that to the clinical data, which are supposedly groundbreaking, with the injectable drugs, they're talking about 12 to 15% loss of total starting body mass over 12 months. With diet and exercise and an injectable. We're doing it just nutritionally and coaching in 12 weeks, on average, 15% loss of total starting body mass. I've made it even better. You're probably thinking 15%, that's nothing. Yeah, we're consistently getting like 25 to 45, 50% loss of total starting body weight consistently with every bloody client now, because our approach is just so refined. But that study showed at 3 years post weight loss, 69.2% of patients maintained that ideal body weight. It's like 70%.
Yeah.
And he goes, this is incredible. And I asked him, I said, what is the standard average out there across the board? And he said, it's certainly less than 10%. It's probably closer to 5%. In my experience, maybe 2%.
Wow.
Okay. So I'm thinking, all right, this is going to be amazing. I'm going to like really succeed at this. I'm going to have him on my side. And I said, great, when can you start sending patients to me that I can make a difference to? Oh, no, I'm not taking any more new patients. I'm heading towards retirement. And I said, all right, have you trained any other preventative cardiologists that I might be able to work with? He said, Dean, let me explain to you how we make our money. We charge very expensive consultation fees, and we overdiagnose with angiography. They get paid sometimes up to $1,000 from the radiologist per referral. Some preventative cardiologists, depending on how busy they are, can make sort of $20,000 a day.
Wow.
Yeah. Sitting in a room, they're not performing surgeries, right? But then you get someone who's actually getting rolling his sleeves up and slamming his hand down the toilet to trying to unplug it, i.e. a very famous neurosurgeon that's just been caned in the media and by his peers, who's trying to actually save lives. But, I know him. He's a friend of mine. He doesn't do himself any favors either. He's cocky. But anyway, look, this is the environment in which 2/3 of the adult population here in Australia who are overweight, at least half of that cohort are obese, trying to figure out how the heck can they handle their weight, restore their health, such that they don't go down the same pathway that they saw their father or grandfather or mother or whatever go down. And they're looking at their kids thinking, I want to stick around long enough to be able to see my kids grow up. I want to meet my grandkids, my great-grandkids. I want to be well enough to travel when I retire. I'm working my butt off. Why? Just for retirement, and then my health will be in such a poor state that I won't be able to do anything in life? What's the point of that? But they're turning to the experts, and and there's thousands of experts now online. It's easy to,
so many,
right? And many of them are amazing. I'd love to work with many of them, but it's very, very confusing for the average health consumer to ascertain what's real, what's not, what should I invest my time in, and money, what should I actually do, and what makes sense. So what I like to do is work with people for a period of time, restore their health and vitality, teach them such that they are at the source of their own well-being. And at some point in time, this is the gift. They say to me, Dean, kiss my skinny ass, don't need you anymore. Bye-bye. And that's just brilliant. That's what you want.
Yeah, I mean, it seems obviously plain and simple to me now after my personal experience going through and trying to find everything. And obviously my background in elite sport was, I guess, believing that you have to exercise. And then being able to shift for myself like 13 kilos in 12 weeks, sitting on the couch. All I did was just eat better.
Yes.
Well, you know, and follow phase one, follow protocol. And that's where, I guess, if you speak to the refinement, as you say, of the protocol, how is it that each part of that works in such a way that you can sit on the couch and just burn through body fat?
Yeah. Well, there's very little scientific evidence that demonstrates exercise has any real value in the context or the commitment to lose weight, right? There's just very little evidence to support the utility of exercise. So if you understand the science of it and you understand substrate partitioning and utilization for fuel, etc. So you've got a certain amount of carbohydrates stored in your muscle and your liver, and that's what you use when you go into the gym and you start exercising. Now, if you're metabolically deranged, i.e., you have high levels of insulin, then that insulin, it's the only hormone in the body that causes the formation of triglycerides, which is the fat storage molecule. And insulin is raised when you eat carbohydrates. Now, if you're increasing your total caloric intake with fat as well, it's a perfect storm for fat deposition. And if you continue to stimulate insulin secretion throughout the day, even when your energy exertion levels are elevated, like you do go into the gym and work out with a concerted effort put towards that, the insulin locks the fat in the adipose tissue. So you can't even effectively access your fat tissue and utilize that as a fuel source. So all you do is you burn through your carbohydrate stores, and then you're more hungry because you still got insulin coursing through your veins, and you're stimulating all of that, and then your appetite goes up because your energy levels are low now. You've just spent yourself at the gym, and then you eat more carbohydrates, and it's just this vicious circle. So if you just get on with your general daily activity, you burn enough calories. You can work out medium to high intensity for 45 minutes to an hour in the gym. You might burn 500, 600 kilocalories. Well, you burn of your basal metabolic rate, sometimes up to 10, I've seen 15% of that BMR is taken up just digesting food.
Yeah.
So if you restrict the carbohydrates, you restrict the total caloric intake, and you eat a good volume of food, your gut needs to stretch a couple of times a day. So these mechanoreceptors in your gut communicates to your whole nervous system that, there's still a plentiful amount of food around. People talk about going into starvation mode and holding on to weight and all that. So it's not really that simplistic. But anyway, if you regulate your meal times, you basically program your incretin system to regulate your hunger, and such that you're only hungry a little bit at the scheduled meal times. And it's consistency. It's just consistency. You got to be consistently uncomfortable for a period of time, and you will reap the rewards. And no one explains this to people. People go into ketosis, they'll restrict carbs, but then they eat all of this fat, and then they wonder why they can't lose weight, or they feel unwell because they've screwed with their gut microbiome with that amount of fat intake. And who knows what kind of fat that they're consuming, and all these keto products, and it's keto this and keto that. And it's not keto unless it's keto. Like, you actually have to be in ketosis. And then there's exogenous ketones, and people think just taking exogenous ketones or consuming a mass amount of medium chain triglycerides is going to do the trick. No, there's still calories. It's still a fuel source. So if you consume exogenous ketones in the form of a supplement, you're just adding in an extra fuel source. versus what our approach is creating a sufficient challenge in which your physiology can adapt, and you turn your body into a fat burning machine where it preferentially burns its own fat. That's what you want to burn off, and not just for the purpose of weight loss, but you also want to transform your intracellular biochemistry, right? So, and turn on that machinery to preferentially burn fat as a fuel. And what's more important than the ketones, you might even consider beta hydroxybutyrate, acetoacetate, and acetone, the three primary ketone bodies that get generated in your liver, converting fatty acids into those ketone bodies. You may as well consider them as a nice byproduct, like a very useful byproduct. Byproduct of what? Of what really matters, which is the intracellular shift in biochemical processing such that those ketones get released and then utilized as a fuel. And for them to be utilized as a fuel, again, the cells in your body have to increase the amount of enzymes required to more optimally utilize those ketones as a fuel source, because our bodies aren't used to running on ketones 24/7. Glucose is the primary fuel source. So that's a different type of biochemical machinery. So if you've been addicted to carbohydrates, which most people are, and then you want to shift your biochemistry, that adaptive process takes several weeks.
Yeah.
Usually 8 weeks for you to fully ketone adapt. Yeah. And people might go keto for like whatever, 2 weeks. And then they think, oh, I've lost a bit of weight, which in the beginning, it's, a lot of that is water mass, because you're draining your muscle of glycogen. And for every gram of glycogen you store in your muscle, you store 3 to 4 grams of water. So a lot of that goes with it. You may have noticed when you're on protocol and with your clients that they piss like a boss, and as did you. And that's not because we're making you drink so much water. You urinate excessively when you start a keto program because you're restricting carbohydrates, and therefore your total insulin output decreases. And one of the things insulin does is it causes your kidneys to retain sodium and therefore fluid. And if your insulin output is decreased, then your kidneys don't have to hold on to all of that, and you just get rid of it all. And that's part of the sort of detox process as well. And so you've got to make sure that you get the water back into you to remain hydrated. That's important because being able to access and then break up those triglyceride molecules, that the fatty acids and the glycerol, that it's called lipolysis. So lipo referring to fat, and lysis meaning the breaking up of. Water is required for that reaction. So you have to remain hydrated. If you're dehydrated, then you won't be able to access and utilize your fat effectively as a fuel, which is what you want to do.
Yeah, it's interesting because as you sort of said, every single part of the protocol has been specifically designed for a reason. There's, the reason why you have the protein, the reason why you have the supplements, why you have the water. And a lot of the time, and I'm sure you've experienced this a lot, I personally was very military style, and whatever you said, I did.
That's why you're a coach, by the way, now, right? Because people, if you're sloppy with your own participation in the protocol and come to me and say, I'd really love to be able to do this, and will you train me? I'm like, no.
Yeah.
No, you were sloppy. So and it's no disrespect to them, and it just, as you can appreciate now, it takes something to coach people through this process. And if you have been a dirty rat yourself, like, you haven't got a leg to stand on in your commitment for others to be unreasonable with their performance and go beyond their reasons and excuses and justification. You can, because you did it, and you did it that way, as did Trevor. And it's so you just have a brain that's kind of wired that way.
Yeah. Well, it's, and it was kind of funny when I first started coaching, I literally didn't understand why people weren't like that too. That was one of the biggest things for me to comprehend, was someone would say to me, oh, I don't really feel like having the magnesium, so I didn't have it this week. And I'd be like, what? It doesn't matter. It doesn't matter if you don't feel like it. It's on the piece of paper. You got to do it. And I remember speaking to you about it and being like, Dean, help me out here, because not everyone thinks the same way as me.
I know. Yeah, I mean, you're very coachable. You had to be. I mean, you're a world champion athlete. So many people have never been coached. They don't understand what it is to be coachable. Right. And so you've got that down in spades, and following instructions. And to be a world champion, there were many, many, many times, I'm certain, throughout your career, you just didn't feel like doing stuff. Like, it really, but you did it anyway. Like, you have a capacity to go beyond, to perform, irrespective of what your internal state is telling you. You know, your thoughts and memories, your mental states, your emotional states, and even your body sensations.
Yes.
And you're able to perform beyond. Even I saw that clip you've got up on YouTube when you were 11 or something. You fell on the beam. And I'm like, oh, that would have hurt. And it was like, you just brushed it off and got back up on the beam and kept going. Right. So people, that's a level of resiliency that we take on working with people to develop in them, not to that degree. I mean, that takes a long time,
20 years.
But at least an opening where someone who's never had any level of resiliency for themselves can experience it, and it opens up the possibility, and they start to get, wow, this is possible for me too. And I could dedicate myself to developing that over time, you know. And this is what people develop as athletes, and in the martial arts in particular, and anything that requires a real physical sort of, places a physical demand on the body, where ordinary mortals like me, you know, I fall once and I'm like, nah, I'm not doing that again. It's like
that's called being smart, Dean.
It happened with my daughter still brings it up every now and again. There was they set up this makeshift roller skating rink on the top of the Broadway shopping center in Sydney. Anyway, we went there a few times, and I was like proud of myself. I hadn't fallen once, and I'm like, all right, I've got this. These little kids, they whiz around the whole thing. They're fearless, you know, and they've got a lower center of gravity. And I just know my brain, it just kept saying, if I fall, I'm higher up than them. It's going to hurt more when I fall. Anyway, I was so proud of myself. And then my daughter skated up behind me and grabbed my jumper and yanked on it. And that was it. I was gone. And my wrist went down and I hurt my wrist. And I was like, no, that's it. Skate's coming off.
I'm done.
Whereas, you know, when you're a kid, you just bounce back up and you keep going. And now I'm like, you know, but this happens with diets and attempts to handle health and well-being. And we become, not only do people quit, they become very resigned and cynical. And no one ever wants to acknowledge that they're resigned and cynical, because that just doesn't look good for them. You know, it says something about them. No one wants to acknowledge that they're resigned and cynical. No, what they say is, oh, that didn't work for me. Right. And, you know, firstly, you got to take responsibility for that. Secondly, you also have to manage the narrative out there. You know, there's no such thing as failure, and, you know, you didn't fail, you learned, there's lessons to be learned, and all these softeners, right? I don't come at it from that approach. Here's, in the vast majority of cases, I would say near 100%, right? There are times when people do actually fail.
Yeah.
Like, you give it everything and you fail to produce the performance outcome that you're intending. Now, does that mean that you are a failure? No, it means that you failed at the playing of that game in that attempt. Doesn't mean that you're a failure. So that's the first distinction. The second one is, understand that all those failed attempts, or that dietary approach failed me or whatever. No, you bloody well quit. Own it. You didn't fail. You quit too early. You saw the possibility of failure And because you failed at stuff in the past and it hurt and it was embarrassing and, you know, whatever, you didn't want to deal with that. So you'd rather quit early and own that. It's like, no, you didn't, you're not a failure. You're a quitter.
Yeah.
And so what makes the biggest difference on protocol, and that's why I have a coach, because left to your own devices, you'll just quit every time. And with a coach, you're making a pact. You have an agreement in place. I won't quit. You won't quit. We just get the job done.
Mm.
And it's almost like, you know, Mr. Miyagi and Daniel-san in Karate Kid. It's like, you know, I promise to teach you karate. And Daniel-san promises to be, you know, a student. And
yeah,
right. And then Mr. Miyagi has him doing all this stuff that he really doesn't want to do, washing the cars and painting the fence and sanding the decks and everything. And, you know, you got to ask yourself, wow, if that was me, at what point would I have quit?
Mm.
But Daniel didn't. And then at some point he cracked the sads with Mr. Miyagi. And then Mr. Miyagi starts throwing punches at him and he discovers for himself that he'd actually learned karate.
Yeah.
And so that's what this process is like. And that's what happened with you. You know, you at some point got that, wow, I'm at the source of my well-being.
Mm.
And it was totally in your control. Whereas previous, when you came to me, it was so not in your hands. You were at the effect of that extra, whatever it was, 15 kilograms, and an endocrinologist, a GP, a sports physiologist, whatever, psychologist, naturopath. None of them could make a difference until one doctor read your blood work correctly and said, oh, I see what's going on here. You need to call Dean Kilby. He's the best at this. And then, you know, you dropped whatever it was, 13 kilograms in 10 weeks from memory.
Yeah.
And I remember you ringing me saying that you put your size 6 shorts on. You were crying.
I know. I was so excited. I desperately just wanted to get into my wardrobe. But you know, one thing I didn't handle was that I was no longer a gymnast. I was no longer training 26 hours a week. And so along with losing the weight, I also had to come to terms with you still look different. And I know for me, that was a huge deal. It actually, you know, now I look back and it had not that much to do with the actual body weight because I wasn't exactly fat. And it was more to do with the fact that I didn't look the same. And I thought as a result of that, that I wasn't the same person then. Anyway, okay, so I think what's important to note is what sets it apart, what makes the protocols so effective is that the coaching is individualized, it is unique, it is sort of like what separates Simplr Health from a lot of other programs. The protocol itself, as we sort of said, it's designed to work with everybody. The coaching itself is designed to work with the unique individual.
Yeah, so the protocol does, there are alternative structures depending on what the patient's dealing with. And we like to work with the client's medical environment as well, where appropriate. So, for example, if they've got severe kidney disease, that's contraindicated for the standard approach that we utilize for everyone else. Or if they're type 1 diabetic, or, you know, if they're pregnant, you know, we just don't take on pregnant clients, right?
Yeah.
We can, but, you know, there's just not enough data. I think it's emerging, and we're seeing enough of the safety now around these approaches because there's so much nutritional biochemistry being published these days. It's near impossible to keep up with it all, but it's bloody exciting. Whereas, you know, the so-called experts, the dietitians of the past would say, oh, it's dangerous. And they'll just put this fear of God in everyone's head. It's like, oh God, it's just like a different way of eating. No one eats the perfectly balanced diet anyway. It's like,
yeah, exactly. But I think that's what's so unique is that, and what I had a lot of comfort in when I did Simplr Health was that it wasn't a fad. It wasn't the keto diet that you hear from an influencer online. It wasn't, you know, some guy yelling around being like, oh, it's calories in, calories out. It was this like scientifically developed program that was designed to work with the human body. And it was kind of like I don't really care about anything else. This is how the human body works. This is every single step that we've thought of, and it will work if you just follow it 100%.
Yeah.
So it
Yeah.
was safe. It was safe. You have someone there to hold your hand pretty much essentially the entire way. Sometimes, you don't want them to hold your hand, but they will anyway.
It's usually, sometimes it's holding the hand. Sometimes it's a foot in the back.
Yeah.
It's like, yeah.
Yeah, absolutely. Which is, a challenge that I now face, being like, which one should I do? Should I hold their hand or should I kick them? I don't know.
Yeah.
But yeah, that's probably one of the most outstanding parts of the protocol, is that it is essentially safe. It's probably the safest, quickest way to drop body fat, whilst also not only is it all about weight loss. I sort of tell people it's about getting your health under control.
Yeah, I had a recent example of that. So, one of my other businesses, the Wine Doctor, where we
Yeah.
elevated the anti-aging properties of wine, right? Anyway, there was someone else in the market that's got this really great product that you consume prior to alcohol consumption. I don't know how effective it is scientifically, but I like the concept, right? Anyway, I said, why don't you come in, let's meet. And, she's young and fit and, hasn't got much fat on her. Anyway, as we were sharing and talking, she said, do you think you'd be able to help me? And I said, what are you dealing with? And she was dealing with a, dysregulated menstrual cycle.
Mm.
She hadn't had her period for several months. And prior to that, there was a time where she didn't have a period, and it took a lot of consultations with an endocrinologist, GP endocrinologist, medication, etc. Eventually, she got it back again, and then at the beginning of the year, it stopped, and she didn't know what to do. And so I said, "Look, let me work with you and explain a few things over a few weeks. Let's do a complete metabolic reset, and just see what your body does with that." Sometimes you just got to provide the body with a bit of a shift in a particular direction, and it adapts and corrects itself.
Mm.
And her mind was blown because she's had a period more recently, 3 months, consecutive months in a row now.
Wow.
Yeah.
Wow.
So we corrected it, and then she went back to pretty much eating, well, how she was eating previously.
Yeah.
But with that therapeutic period, it seems to have solved the problem.
Yeah. Well, I think I sort of describe it as getting yourself back to a stable baseline. A lot of the time, once you've gained the weight, well, for some, they'll go, oh, shit, better clean up my diet. Better just start doing some things differently. I better start eating some more vegetables. But they've not actually gone to the root cause. They've not actually got their levels sort of like back down here. So then they're up here, they're trying to eat healthy, they're trying to see a result, they might lose a little bit of weight, but they can't maintain it. And it's because they've not actually gone back to baseline. So they're trying to do everything right. And odds are they probably are doing everything right, but they need to fix it first.
Yeah. Yeah. It's uncomfortable. You've
Yeah.
got to go in the other direction. It's like if you've been cheating on your partner, for example, right? You can't just all of a sudden, in the privacy of your own mind, go, all right, I've got to work this out. I don't want to be a cheater. I'm just going to not cheat anymore.
Yeah.
And then expect to go back to your relationship and think that it's going to flourish. No,
Yeah.
you got to go tell your partner what you've been doing and deal with the consequence of that,
Yeah.
and if that means, it costs you the relationship, or, there's a period of time where you kind of got to start afresh, you got to rebuild, then that's what you got to do. And similar to this diet, if you've been unbalanced in a particular way and your health and well-being has gone down the wrong path, then nutritionally, which is foundation to all health and well-being, then you've got to shift it the other way. It's got to be unbalanced in the other direction. If you just go balanced, then there's no change.
Mm.
And then over a period of time, you're like, I'm eating so well, why can't I lose weight? Well, you got to shift for a period of time and then bring it back to balance.
Yeah.
Right. So that's what we do. But that bit is not easy. And so we guide people through that, and we make it pretty structured, and you know.
Yeah. Well, and I guess for me, I've only been really coaching for like a year, but at least I reckon every single client that's been complete that got their bloods done before and after, they've all gotten their insulin levels down.
Yeah, there you
Like
go.
massively.
Yeah. And the
Yeah.
key with this is it's an approach that's designed not just to have people lose weight. It's to have people lose the fat that they don't want, transform their biochemistry, reduce the inflammation, preserve their lean muscle mass without strenuous exercise. And if you've got achy joints and all that sort of stuff, and you're not fit, exercise, I mean, you don't
want to do it.
But then there are people that are addicted to hard work because you can't, how you produce results in life is hard work. And just being disciplined around, self-parenting and saying no to yourself with all the temptations, food temptations in life. And like you said, you don't have to exercise. I like people to start feeling well and then coming to their coach saying, I just feel amazing. I'm waking up in the morning and actually experiencing waking up. I'm more productive before 10 a.m. My aches and pains aren't there anymore. I've got so much more energy. Can I start exercising now?
Yeah.
And then have their coach say, yeah, absolutely. Go for walks, regular walks every day, but nothing strenuous. Don't get yourself out of breath. I don't want your heart rate above 70 beats per minute, 70% of maximal heart rate.
Yeah.
And don't push yourself, except, if absolutely necessary. Like, you don't want your blood pressure or heart rate going up unless you're yelling at the kids or having really, really great sex. And neither of those two ought to last too long.
Yeah.
Well, one ought not to. The other one just generally doesn't.
Yeah. Oh man.
Yeah.
Okay, we'll sort of like get ready to finish up. There's just two things that I wanted to touch on very, very quickly. One, which might not be a quick one, but I don't know if you can summarize. Ozempic. I've had two people, well, at least 2-3 clients that either came to Simplr Health because as a result of their doctor saying, I'm going to give you Ozempic because you can't lose weight, and then they had a freak out and were like, absolutely not. My life has surely not gotten to this point. And then similar ones have said, oh, my friends have been prescribed Ozempic and they're taking that. What's your take on that in a summarized version?
Oh gosh, it has its place, absolutely, in the armory of a doctor who understands obesity medicine and understands the drug and its utility. And its utility can make a big difference to someone who's been really, really struggling, right? Really, really struggling, especially those who have more severe, they experience more severe depression, right? So it's right. And that can go hand in hand. I mean, if you're unwell, metabolically unwell, your gut microbiome is screwed, you've got lots of brain inflammation. It's really hard to get motivated to do anything. So sometimes just taking a pill now or an injection, the pill form is, I don't know when that'll come to market, but that's been developed. But these injectable drugs were originally developed to treat type 2 diabetes. And then, weight loss was observed and then they were repurposed for that. I think people have been too happy and too easily seduced by the possibility of just thinking that this will be the answer. And look, bariatric surgery and the various forms of that were met with a similar kind of welcoming. And that it has an item number and people can just get these kind of procedures done, whether it be a sleeve or a balloon or a bypass or whatever it might be. It comes with its own issues. I mean, you reduce the stomach to like a total volume of about 80 milliliters. That's all the food that you can consume. And you need to get maximal nutrition to be able to stay well and perform. But if your stomach's only that big, then you got to be really smart with what you put in there and how frequently. It doesn't do any favors to your gut microbiome either. And therefore the relationship between your gastrointestinal tract, especially the nerve endings in your colon and your brain. So, these Ozempic, semaglutide, etc., Wegovy, they go by few different names. it's basically a biochemical simulation of bariatric surgery, that
Right.
kind of procedure. So what it does is it modulates the biochemical system called the incretin, incretin, incretin system that regulates predominantly gut transit and also hunger, the experience of hunger. That can be programmed, like I said, just by consistently eating at the same time every day.
Yeah.
You can program that, and it happens fast. Within 3 weeks, you can program your incretin system. But my relationship to these types of medications, when people just want to lose weight and I don't know why people do this stuff, but if it's someone who's morbidly obese, and yeah, it could make a big difference. I'm all for empowering doctors to do that, but they've got to come up with an appropriate exit strategy to support the patient to come off of that medication, which currently, there isn't a structured exit strategy for these medications. So people are told you're going to have to be on it for the rest of your life, because you stop taking those injections, you'll just put the weight back on. Secondly, my relationship to them is like injecting peptides or testosterone, for example. If you inject testosterone, for males, your testicles aren't going to, do what they're supposed to do. So,
Yeah.
if you mess with that ligand binding response with an exogenous, if you inject a molecule in and it disrupts your own natural system,
Yes.
your own natural system will down-regulate. Like, it doesn't have to do its job. So it's like use it or lose it. So you'll start to lose it.
Kind of like the contraceptive pill and stuff.
Yeah.
Mm.
I mean, that's a different story, but
yeah,
different purpose. I mean, when Carl Jurassic invented that, he changed the world, right?
True.
But with these medications, yeah, they have their place. I'm not the biggest fan of it. For the vast majority of people, they need a coach, they need some science and a willingness to be educated.
Yeah.
And you just got to do it. You just got to put all your excuses, reasons, justifications, explanations, all the BS that you've been telling yourself to the side, and allow someone who's committed to the outcomes to contribute to you. And that is in and of itself a transformation. People who are willing to be able to do that, they have to become a different person. And there's enough flexibility, not only in your physiology and biochemistry, but also in your ways of being and who you've considered yourself to be. And previously you were being an athlete, and then you were being someone who, gained weight, and you were 15 kilo, you were whatever you call that person. And then you became someone else. And now as a coach, you realize that every client that you coach, you end up at the end of it all, you're not the same person either. Like, you go through that transformational journey with them. And that's what's extraordinary about being a coach. It's, that's what adds variety to our lives. Yeah.
Yeah, couldn't agree more. I'm very lucky to do what I do. It's worth getting fat for. That's for sure.
Yeah, you just can't stay there. The more years you remain overweight and obese, the smaller your brain becomes, and you leave yourself, I mean, physically, it becomes smaller. You leave yourself more susceptible, not only to cognitive decline, and people want to hold on to their cognitive prowess as long as possible and their memory, etc. But these neurodegenerative disorders seem to be happening earlier and earlier in people's lives, and it's pretty clear to me that it is a function of the nutritional environment that we're all living in. And dementia is considered by many as type 3 diabetes. So it all starts with metabolic dysfunction, many cancers as well. Like 80% of cancers start with some form of metabolic dysfunction. That's why obesity is also a risk factor, not just for degenerative joint disorders like osteoarthritis, but also more severe diseases like cancers. So, we want to handle that. Yeah.
Well, thank you for, I don't know, doing good work and bringing me along.
Oh, you too.
That's for sure.
You're the one that's carrying the torch. So, you keep going. doing a great job.
Thank
Frees
you.
me up to go do some other stuff, like cure cancer for people who have been diagnosed, etc. So where Simplr Health has been supported by the Australian government to do some preparatory work to see if we can, get a chance to build a regenerative health facility and cancer treatment centre in Bali. And I'll be bringing technology from Japan, and their regulatory environment and clinical experience far surpasses anyone else in the world. So if we can get this up and going, it'll be the first time that Japanese regulatory approved technologies such as immune cell therapy and stem cell therapies can be translocated to a site other than Japan. And why not have it in Bali? Hey,
Crazy. You read my mind, because my last question was going to be, what's the future for Simplr?
yeah.
So I love it. It's
More
very
of that. I'd like to, work with different countries in establishing these kinds of breakthrough infrastructure. And in the meantime, we're committed to making as big a difference as we possibly can to as many people as we can with metabolic dysfunction, because as far as I can tell, that's the underlying pathology that leads to many other disorders. So, let's keep going.
love your work. Thanks so much, Dean.
Thanks, Emma.